Hello, my name is Katie Ardini and I'm a dietetic intern at OSF St. Francis Medical Center in Peoria, Illinois. Today I will be discussing managing diarrhea during cancer. This webinar is a collaborative effort presented on behalf of the Cancer Center for Healthy Living and OSF St. Francis Medical Center based in Central Illinois. Thank you for participating in this webinar, and I encourage you to complete the short survey at the end of this presentation and welcome your feedback. Today we will be discussing the causes of diarrhea during cancer treatment and the consequences if diarrhea symptoms are not treated. We will discuss the different treatments of these unfortunate symptoms and examine the delicate role that fiber plays in diarrhea management. Finally, I will provide diet strategies for prevention and treatment of diarrhea. Diarrhea is one potential side effect of cancer treatment. Radiation therapy to the abdominal area can cause diarrhea, as well as certain chemotherapy medications. Sometimes an infection such as C. difficile can be the cause of symptoms. It is important to identify the cause of your diarrhea symptoms so the best treatment plan can be used to treat your individual symptoms. If infection is the cause of your symptoms, the suggestions provided in this presentation may not be beneficial, and if you suffer from neutropenic fever, these suggestions will not be appropriate. Be sure to talk to your doctor or oncologist before starting any treatment plan. Some factors may put you at risk for developing diarrhea during cancer treatment. Stress and anxiety, as well as multiple treatments, can cause diarrhea symptoms to develop. Some of these risk factors cannot be avoided, so it is important to work with your doctor to identify the cause of your symptoms and develop the most appropriate treatment plan. Although diarrhea is a side effect itself, it can cause its own detrimental side effects. Skin breakdown, cramping, and loss of appetite are just a few consequences of diarrhea. These can lead to serious, sometimes life-threatening situations if left untreated. Severe diarrhea causes dehydration and loss of important minerals, including sodium and potassium. This can be a life-threatening situation, so please do not ignore diarrhea symptoms. As previously mentioned, it is extremely important to identify the cause of your diarrhea. The most important thing you can do to control diarrhea during cancer treatment is to take any medication as prescribed. As with many treatment side effects, prevention can be more effective than cure. If your medical team prescribes medication to prevent diarrhea, do not wait until you have diarrhea to take it. Once this condition is very severe, it can be more challenging to bring under control. Making changes to your diet may help alleviate your diarrhea, and guidelines for diet changes will be provided later in this presentation. However, before we begin discussing these strategies, it is important to remember to speak with your doctor or oncologist before making any of the following dietary modifications. A quick warning before we begin: in addition to discussing treatment options with your doctor, if you have any of the conditions listed here, you should not use these dietary suggestions, as they have not been shown to help diarrhea symptoms in graft versus host disease or in those suffering from neutropenic fever or Clostridium difficile, also known as C. difficile or C. diff infection. One way to help correct diarrhea is to decrease the rate that food moves through your bowels. This can be done by avoiding high-fiber, gas-producing foods such as nuts and beans, and you may also want to avoid foods like corn, broccoli, or cabbage. Following a low-fiber diet may be better tolerated with diarrhea because it will not stimulate the bowel as much as it will be easier to digest. In addition, limiting the kind of fiber in the diet may be beneficial. Insoluble fiber passes through our bodies without being broken down and helps increase the rate food passes through our bowels. One of the reasons it is often used to prevent constipation. When dealing with diarrhea, this type of fiber, found in whole wheat, bread, nuts, and many vegetables, should be limited. Soluble fiber is another type of fiber found in food. It absorbs fluids and can help relieve diarrhea. Applesauce, bananas, canned fruit, potatoes, white rice, and oatmeal are all foods high in soluble fiber. These foods should be included more often than foods with insoluble fiber. However, fiber intake on the whole should be limited to reduce the amount of agitation to your diarrhea symptoms. This slide is a sample meal plan to follow if you have diarrhea. It is low in dietary fiber and high in insoluble fiber. As you can see, there are six smaller meals and or snacks laid out in this meal plan. Eating 5 to 6 small meals or snacks, as demonstrated here, can oftentimes be better tolerated than eating 3 large meals that you may typically eat. Another diet that may be beneficial for managing diarrhea is to follow what is known as the Brat Diet. This diet is often prescribed to toddlers suffering from diarrhea symptoms, but can be a useful tool for those experiencing symptoms during cancer treatment. The foods in this diet are binders and cause mild constipation. This diet is made up of bananas, rice, applesauce, and toast. Bananas are a bland fruit that can be constipating, a good thing when symptoms include diarrhea. When choosing bananas on this diet, you want to choose bananas that are very, very ripe, as these are the best tolerated and best for diarrhea symptom relief. Rice is well tolerated and is likely to not cause further nausea. The creamy consistency of applesauce goes down easily, and the cold soothes a dry throat. Almost everyone likes toast, and with a teaspoon of jelly, it can add needed calories for those who need to keep their strength up. Another important note is that when choosing rice or the toast, it's important to choose white, not whole grain rice and toast. As mentioned before, the whole grain is where you find that insoluble fiber, and that is the type of fiber we want to limit. So always choose white rice and white toast when following the Brat Diet. When dealing with diarrhea, it is important to realize that your body is not absorbing the fluid that it needs. Dehydration, therefore, is frequently associated with diarrhea. It is also important to realize that signs of dehydration do not start with thirst. Thirst can actually be a sign that you are already dehydrated. Dehydration can easily become a serious medical issue in those who are suffering from diarrhea, so it is important to be able to recognize the signs and symptoms of mild, moderate, and severe dehydration. Mild to moderate dehydration can cause a decrease in how frequently you urinate. It can also cause muscle weakness, a feeling of tiredness, and a dry, sticky mouth. Severe dehydration can cause a decrease in how frequently you urinate. It can also cause more severe symptoms such as irritability, confusion, and dark, sometimes amber-colored urine. It may also cause dry skin and a very, very dry mouth with almost stringy-like saliva. Severe dehydration can also cause fever and fever-like symptoms. It is important for those suffering from diarrhea and their family members and friends to know the signs and degrees of dehydration so that symptoms can be identified as early as possible and treatment can be given. In addition to identifying signs of dehydration, in the next slide we'll talk about ways to prevent dehydration during diarrhea. It is important more than ever when suffering from diarrhea to drink at least 6 to 8 cups of liquid each day to prevent dehydration. To better tolerate these liquids, it may be helpful to sip liquids slowly, but constantly, all day. Challenge yourself and try to take at least one small sip of liquid every 10 to 15 minutes. Try electrolyte replacement drinks such as Pedialyte, which does not contain as much sugar as some other sports beverages. Powerade and Gatorade may also be helpful, but they do contain more added sugar than the Pedialyte. Pick one that has about 50 calories per serving. More calories means more added sugar, which can worsen your diarrhea. To be sure you are getting enough liquids, try to drink 1 additional cup of liquids for each episode of diarrhea. When suffering from diarrhea, you can make your own fluid replacement drink in a pinch. Listed here is a recipe for a quick and simple fluid replacement drink. These drinks can help replace lost fluids and important minerals called electrolytes that our bodies need to properly function. To make this simple fluid replacement drink, mix together 4 cups of water, 1 tablespoon sugar, 1/2 teaspoon baking soda, 1/4 teaspoon salt substitute, and 1/4 teaspoon salt. Salt substitute is a salt-like substance that is made up of potassium chloride rather than sodium chloride, which makes up table salt. The salt and salt substitute will provide electrolytes that are typically not absorbed by our bodies as well when suffering from diarrhea. Be sure to enjoy this mixture within 4 days to avoid any food contamination. Some additional mealtime tips are listed here. Eating 5 to 6 smaller meals and snacks can often be better tolerated than eating 3 large meals. Snacking on plain, salty foods such as saltine crackers or graham crackers can also be helpful, as well as eating a few bites at a time to avoid nausea. If you are able to tolerate dairy foods, eating a small amount of plain yogurt can help to provide good bacteria cultures needed in our stomach and intestines that may oftentimes be lost during periods of diarrhea. Always remember, however, that these tips included in this webinar are not suggested in those suffering from neutropenic fever, graft versus host disease, or C. difficile infection. When dealing with diarrhea, there are some foods that should be avoided to avoid aggravating or worsening symptoms. Avoiding greasy, fried, spicy, or very sweet foods, which can exacerbate symptoms, can be very helpful. Some people with diarrhea may begin to have trouble digesting milk. If this occurs, try substituting milk with lactate, soy milk, or rice milk. Avoid drinks and foods that cause gas, such as carbonated soda, and gas-producing vegetables, such as Brussels sprouts. It may also be helpful to limit the use of sugar-free gums and candies, which can be made with sugar alcohols. Sugar alcohols are neither sugar nor alcohol. They can occur naturally in certain fruits and vegetables. However, large amounts of sugar alcohols are produced by food manufacturers for use in commercial food products. They are recognized as safe for people with diabetes and the general public. However, sugar alcohols may cause gas, bloating, diarrhea, and headaches when consumed in large amounts, and some people may experience these side effects with even a small amount of sugar alcohols. For these reasons, sugar alcohols should be avoided when suffering from diarrhea. Sugar alcohols are often found in sugar-free candies, chewing gums, frozen desserts, and baked goods. To help identify if a product contains sugar alcohols, look for the ingredient names listed on this slide in the ingredient list on the Nutrition Facts food label. In conclusion, diarrhea is a common side effect of cancer treatment, and sometimes medication may be given when starting treatment to try to prevent symptoms. If left untreated, diarrhea can lead to a serious, life-threatening situation. Your doctor can tell you if diet changes are an option for your symptoms. Decreasing the amount of insoluble fiber in your diet and following a Brat diet may help reduce diarrhea symptoms. It is important to drink enough fluids, eat smaller, more frequent meals, and avoid sugar alcohols while treating diarrhea. Thank you for participating in this webinar brought to you on behalf of the Cancer Center for Healthy Living and OSF St. Francis Medical Center. This program has been made possible in part by a grant from the Heart of Illinois United Way. Also, this program has been made possible in part by a grant from Susan G. Komen. If you found the information in this presentation helpful, please take a few minutes to complete a survey. Completing this survey is a great way to provide feedback and will help us continue to provide these public service webinars in the future. Thank you again for participating in managing diarrhea during cancer. My name again is Katie Ardini, and I am a dietetic intern at OSF St. Francis Medical Center, and I hope that you will be able to use the information provided in this webinar to improve your symptoms while going through cancer treatment.